Good evening. I'm Psychiatrist Jay Fawver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now going on its 28th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call in the Fort Wayne area by dialing 969-2720, or if you're calling any place coast to coast, you may dial toll-free at 866-969-2720. Now, on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. That's Matters of the Mind at WFWA.org. And I'll start tonight's program with an email question I recently received. It reads, Dear Dr. Fawver, I've been off Effexor for 3.5 weeks. It's been terrible. How long can this last? I've been on it for 19 months at 75 milligrams once a day. Everybody has different sensitivities to discontinuing a medication like Effexor. It's actually called the discontinuation phenomenon, where when you stop it abruptly or even taper off a little bit too quickly, you can have zings and zaps in your hands and feet. You can have a dizzy, spinning feeling in your head. My goodness, when it first came out in 1995 in the immediate acting formulation, people, when they missed a dosage, thought they were having a stroke, and now it's all in the extended release version. So with Effexor, the slower the better, and for some people, they do need to take a medication like fluoxetine or Prozac along with it as they taper off. That tends to ease the withdrawal, but the slower you taper off of it, the easier it becomes. You just happen to be one of those people who is very sensitive in coming off of it. So talk to your clinician about strategies for tapering off of it even slower than you are, or adding something like fluoxetine to ease some of that withdrawal. Thanks for your email. Let's go to our first caller for tonight. Hello, Ted. Welcome to Matters of the Mind. Ted, you'd mentioned that several years ago you visited Auschwitz in Poland. After the visit, you had no appetite and experienced nightmares. Is that a physical reaction that's normal after a traumatic experience? Yeah, if you have no appetite and nightmares following a traumatic experience, that can be quite common. What's happening when you experience that, Ted, is your emotional center of your brain is what was getting fired up. Here's your brain looking at you. That's the left side of the brain. On the inside part of the brain, you've got this emotional volume control that's getting all fired up, and then the amygdala is the actual area of the brain, and then temporal lobe that is the volume control for anxiety, fear, anger. And what happened when you visited Auschwitz, this emotional volume control got really fired up. And in the center of your brain is where you also have areas that regulate appetite and regulate a lot of the physical type of phenomena going on in your body. So your emotional response affected you physically during that time. What you want to do after experiencing any kind of physical type of phenomenon related to trauma, Ted, is to talk about it. This is why soldiers coming back from World War II didn't have as much post-traumatic stress as did the Vietnam soldiers who came back from Vietnam, because when the soldiers came back from World War II, they came back on a long trip on a ship typically, and they debriefed with their buddies, and they talked and talked and talked about their experiences. When you talk about your experiences, the experiences get centered more in your logical part of your brain, the front part of your brain, and it takes it away from the emotional part of the brain. That's why techniques such as eye movement and desensitization and reprocessing therapy are so effective, because basically they take the emotional valence of the experience to a thinking part of the brain. And another type of treatment is rapid resolution therapy, where you're doing nonsensical things as you talk about the past experiences, and in doing so, you take away the emotional influence and put it into the thinking part of the brain. So yes, a physical manifestation can be quite common following a traumatic experience, because the physical part of the brain is deep inside the brain. It's a very primitive part of the brain, and that's not uncommon. Ted, thanks for your call. Let's go to our next caller. Hello, Macy. Welcome to Matters of the Mind. Macy, you want to know if there's a condition that makes remembering faces difficult. There is a condition where you don't recognize faces so well, Macy. It's called prosopagnosia, and this is a condition where it can be something that you experience from childbirth, or it can happen after a stroke. particularly in this area right under the temporal lobe. Let's see, the temporal lobe on the right side here. As I pick up the brain, it's the brain looking at you. So I pick up the brain, the temporal lobe on the right side here. It's called the fusiform gyrus, and that's the part of the brain that's particularly prominently going to remember faces for you. The hippocampus, the memory library center for you, is right up here, the hippocampus, but right below that part of the thumb of the temporal lobe is the fusiform gyrus. And if you damage both sides, that can be particularly problematic. But if you have a stroke, for instance, on the lower right side, particularly of the temporal lobe, affecting that fusiform gyrus, that can cause you to have difficulty with facial recognition. So what do people rely upon when they meet and greet other people when they can't remember their faces? They rely on their clothes they might have been wearing previously, their tone of their voice. They might even be triggered by different mannerisms the other person might see, but they won't recognize their face itself. It's a true neurological condition that can be seen from childbirth or from brain trauma itself. Thanks for your call. Let's go to our next caller. Hello, Darlene. Welcome to Matters of the Mind. Darlene, you want to know, how does being anemic affect your mental health? You might have heard me mention that before, Darlene, because when we think about the common medical reasons why people will have mental health issues, the things we don't want to overlook, there will be things like blood sugar abnormalities, high or low blood sugar, sleep apnea, where you pause in your breathing or you snore at night. That'll cause mental health issues. Thyroid disturbances, high or low thyroid, can cause you to have mental health issues, but low iron and anemia can give you mental health difficulties and be manifested by fatigue, poor concentration, and some people will just say they feel really depressed and blah. So when people have low iron, well, we have to consider that. Why would somebody have low iron? Well, you can have a woman who's heavily menstruating, maybe somebody who's a vegetarian, they're not getting enough iron. Somebody has a slow gastrointestinal bleed, it's very subtle. Older adults especially with slow gastrointestinal bleeds can have low iron. So as a psychiatrist, I will not uncommonly look for low iron. And a symptom that seems kind of unusual when somebody has low iron will be restless legs. They'll have fatigue, they'll have difficulty with depression, and they'll have difficulty with various other mental health symptoms, but they'll often have restless legs. So if somebody has restless legs, we sometimes will think in the back of their minds, wonder if they have low iron, because low iron will cause restless legs. So if you correct that with iron supplement, usually it'll be done so with a pill, depending on what kind of the problem might be, we can often correct that. So low iron can give you mental health difficulties. That's why as a psychiatrist, I am a physician. As a psychiatrist, I have to consider that. When somebody's telling me they're fatigued, they have restless legs, they can't concentrate, we will think about low iron. And that will often go along with the more obvious signs where somebody's pale. We'll often ask a woman who's in her 20s or 30s if she's heavily menstruating. Women who have uterine fibromas will be heavy menstruators not uncommonly, and they'll have low iron as well. So we can't overlook that and simply give somebody an energizing antidepressant or a stimulant to try to bring them out of that. We have to look at the underlying problem. So it's important that we try to treat that problem. Thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, is it ideal for my psychiatrist to work with my family practitioner? Will I have a better outcome if I'm seeing both my psychiatrist and my family doctor? I have this scenario all the time. I'm a psychiatrist. The family clinicians will be treating people for underlying physical health problems like hypertension, hyperlipidemia, diabetes, asthma. And I will look at their medications, they'll look at my medications. But as a psychiatrist, they are often referring to me to get somebody on presumably the right medication from a mental health standpoint, but I have to take in consideration what medication the primary care clinician will be using. So we'll often be on the same electronic medical records, which is a phenomenal tool. We've had it readily available since about 2005, where it's pretty standard practice now, where clinicians and specialists such as myself can communicate very readily back and forth and let each other know what we're doing. And if we have questions, if we're on the same electronic medical record, as many of us are, we'll simply ask a question in real time and we can communicate by text messaging back and forth right in the middle of the day. Thanks for your email. Let's go to our next caller. Hello, Marcus. Welcome to Matters of the Mind. Marcus, you want to know if I can explain contamination obsessive compulsive disorder, or contamination OCD. When your friend can't remember opening a bottle, they'll just throw it away if they can't remember if they opened it already or not. Contamination OCD, Marcus, is a condition where somebody has intrusive, inappropriate thoughts concerning contamination, and inappropriate thoughts that are intrusive are considered to be obsessions. Compulsions are where you do something to carry out that obsession. So in your friend's case, your friend is inappropriately concerned that a bottle might have already been opened. Now there's ways of checking to see if it's already been opened, obviously, but if your friend just knows that it's probably not been opened but throws it away anyway, the compulsion aspect of that is discarding the bottle itself, even though your friend knows that it shouldn't have to be discarded. So obsessive compulsive disorder will be manifested by sometimes aggressive obsessions where you have thoughts that come to your mind, checking obsessions where you just feel like you need to check things over and over again, and you carry that through by checking door handles and checking the floors and checking the locks and things like that. People can have different obsessions, such as having excessive doubting that something didn't go right. They'll have obsessions about their health, knowing they don't have to think that hard about their health. So obsessive compulsive disorder is basically where in your front part of your brain, you have a little bit of loop here that's going on here, and it loops around and around and around. It's like an old record player where the needle gets stuck. So you have this obsessive thought you can't get off your mind, and it just keeps going and going and going, and you struggle with letting it go. And it sounds like that shouldn't be big of a deal for people, but it is. It can be very, very impairing when they have these thoughts they can't get off their mind, and it'll cause them a lot of anxiety and sometimes impair their ability to think. So OCD, or obsessive compulsive disorder, will often be treated with the serotonin medications, Luvox being the first on the list, because Luvox, also known as fluvoxamine, has this added benefit of being a very strong anti-inflammatory medication. It will stimulate this particular receptor called a sigma-1 receptor, and in doing so can decrease inflammation. So Luvox, or fluvoxamine, is used for OCD, but it's also used for various types of inflammation. It was a medication that was used quite predominantly during the COVID pandemic. When people would have an infection in their lungs, they would take Luvox, or fluvoxamine, as a means of treating not OCD, but treating the infection of their lungs. So fluvoxamine can help with OCD symptoms, but it's thought that maybe OCD has a component of inflammation accompanying it, and based on that inflammation, Luvox can be particularly helpful for people in that way. Thanks for your email. Let's go to our next caller. Hello, Ann. Welcome to Matters of the Mind. And you want to know, why does your attention deficit hyperactivity disorder cause you to hyper-focus on certain foods? Well, ADHD can cause you to hyper-focus on a lot of different things, and this is where people will have a misperception about ADHD, because they'll say attention deficit, why am I able to focus on computer games? Why am I able to focus on certain aspects of history? Some people with horrific ADHD are phenomenal mathematicians. It's because if you're interested or challenged, or you find something exciting or novel, you can focus on those particular areas of interest to the point where you can almost get so involved, you forget to eat, you forget to go to the bathroom for a while. You just are there for hours focusing on that particular topic. So in your case, Ann, it sounds like you are hyper-focusing on foods, and I presume that means you're hyper-focusing on the preparation of foods as opposed to binging on foods. But if you are preoccupied with binging on foods, it's an interesting phenomenon that we've seen, that people with ADHD are more prone to being binge eaters anyway. And it has to do with dopamine. When you fire up dopamine, as you can do with binge eating, you're also helping with the concentration. Not a good way to do it, but when people binge eat and they blast themselves with a bunch of carbohydrates, they can indirectly give themselves a little kick of dopamine, and a little kick of dopamine will help you concentrate better briefly. It's like a puff of smoke. It doesn't last very long. So it's not uncommon people will binge eat and have ADHD. There is a medication that we use for both phenomenon called Vyvanse. Vyvanse is lisdexamfetamine, and lisdexamfetamine will be a medication that will help people with ADHD and binge eating. It helps with both conditions, because the clinicians who researched that particular product realized that those conditions went hand in hand, not uncommonly. And thanks for your call. Let's go to our next caller. Hello, Ben. Welcome to Matters of the Mind. Ben, you want to know, is creating fake scenarios in your head normal, or could that be a sign of a mental disorder? It would only be a sign of a mental disorder, Ben, if the fake scenarios in your head are causing you functional impairment, where you're having a hard time getting your job done, you're having a hard time socializing because you've got these fake scenarios going on in your head. But fantasy is fine. Fantasy is perfectly fine. It is a way for people to cope in some ways, as long as you don't maybe express your fantasies out loud excessively to the point where you're not realizing what's real and what's not real, and other people around you aren't sure what you're really talking about, and they might be assessing your integrity about the kind of things you're discussing. So scenarios or fantasies in your head, that's not uncommon. It can be a stress reliever for some people because it helps you kind of think about alternative scenarios of your current reality around you. Thanks for your call. Let's go to our next caller. Hello, Paula. Welcome to Matters of the Mind. Paula, you want to know about the benefits of taking Paxil, also known as Proxetine. Proxetine or Paxil came out in about 1994, so it's been around for over 30 years now. And it's a medication that's a very strong serotonin reuptake inhibitor. And what that means is it's going to profoundly increase serotonin in your synapse and thereby stimulate the 14 different serotonin receptors that are in the periphery. So if you think about your little serotonin neurons being like shotguns, and they're firing out these serotonin bullets, and these bullets spray out all over the synapse, and then will stimulate 14 different serotonin receptors. Some of them you want to stimulate, some of them you don't. Paxil will profoundly decrease anxiety, and that's what its primary use will be. Social anxiety, OCD, panic disorder, sometimes generalized anxiety, also known as worry, that can be helped with Paxil. Paxil can be very calming for some people, and it is approved at low doses in a particular formulation for menopausal hot flashes. So Paxil can be used for various reasons. You're currently experiencing weight gain from the Paxil by your report. Yep, that is a side effect that's related to one of those receptors called serotonin 2C receptors. The receptors go by a number and a letter, and the 2C receptor is one of the 14 different serotonin receptors. That receptor, upon stimulation, can sometimes give you weight gain, and that's where the problem with Paxil. So in taking Paxil, you have to be aware it can give you more side effects than some of the other serotonin medications like Lexapro, Celexa, Zoloft, Prozac, Luvox, I mentioned before. Those are all serotonin reuptake inhibitors as well. We kind of stray away from Paxil for that reason. Not only can it cause weight gain and a lot of fatigue, but it also can give you a lot of difficulty if you miss a dosage. I mentioned earlier the effects or discontinuation symptoms of the zings and zaps in the hands and feet, the dizzy feeling, the feeling like you're having a stroke when you stop Effexor too quickly. Well, the same thing can happen with Paxil. And of the serotonin medications, Paxil is one of the more likely medications to give you those kind of discontinuation symptoms. Paula, thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, is there one thing that a person should do to maintain good mental health? There's a lot of things you could do to maintain good mental health. One thing, the one thing people all ought to be doing is keeping an active lifestyle where they have some meaningful and purposeful rhythm to their day-to-day life. In other words, you need to have something to get up for, to use some very bad grammar there, but you need to have a reason to get up. You need to have a reason to get up every day. People who retire, people who are off work, people who don't have structure in their lives are more likely to have mental health problems. I remember 25 years ago, there was this huge study involving thousands of people across the country with substance use problems, all right? So all these people have substance use problems, they have alcohol dependence, and they look for any common type of factors that contributed to their having substance use problems, and they found the one factor that was very common for all of them was they had a disorganized, chaotic lifestyle. In other words, day by day by day, everything was different. So you need to have routines in your life. You need to have a time where you go to bed, a time where you typically get up, a routine in terms of what you do when you get up. That can be walking your dog, it can be simply getting a cup of coffee, having a routine day by day by day. Working out is always a good routine. You want to add some good habits in there, but you need to have some kind of routine involved in your life. There was a very famous psychiatrist, Ellen Franks, I believe was her name, from the University of Pittsburgh about 20 years ago, who actually developed this therapy called social rhythm therapy. Social rhythm therapy is basically a therapy that she developed for people with mental health issues in general, where the whole idea was to hour by hour by hour plan your day. Now that sounds very boring and too routine, but having something to do hour by hour by hour, as opposed to having that disorganized, chaotic lifestyle that somebody with substance use disorder might experience, that's very, very important. So having meaningful, purposeful activity every day, something that you feel is fulfilling and you feel like you're helping other people in doing so. So there's a lot of factors there, but having meaningful purpose activity on a day-to-day basis, going along with that social rhythm that Ellen Franks talked about. Thanks for your email. Let's go to our next caller. Hello, Saul. Welcome to Matters of the Mind. Saul, you want to know, are there any dangers to your mental health when you do not reach deep sleep? Deep sleep, Saul, is where if you are awakened during deep sleep, you'd be kind of confused for a few seconds and you might not know where you are. That's a good thing. That means you're in deep sleep. So deep sleep is what you experience when you've maybe not slept very well for a couple nights because you were working or you had other obligations, and now you finally got a chance to sleep a little bit extra and you have some sleep debt and you're catching up with it. Well, that's what deep sleep will do. Deep sleep is where you go into this very slow wave sleep and you're kind of confused when you awaken. If you're in deep sleep, you can inadvertently have sleepwalking. And you can have night terrors as a child where you awaken in the middle of the night kind of screaming and you're confused. It's not a nightmare, it's a night terror. So with that being said, deep sleep is very important. How would you be affected if you didn't get adequate deep sleep? Deep sleep is particularly important for our physical health. So if you didn't get deep sleep night by night, you'd be more prone to infection. And if you didn't get adequate deep sleep, you'd be more prone to heart problems, maybe a lung problem. You'd have more trouble with your energy level and get up and go. So lack of deep sleep can be very impactful for somebody who is having medical issues already. So we try to get people into deep sleep and try to avoid medications that might decrease deep sleep. The deep sleep is a very good thing. If you get deep sleep, that's where you'll be confused upon awakening. Thanks for your email. Let's go to our next caller. Hello, Nancy. Welcome to Matters of the Mind. Hello, Nancy. Okay. You're on the air.
Okay, thank you. I have a friend who was injured in a truck accident, hit the frame of the front window, broke the window, of course, hit his top of his head on the frame of the truck.
Okay.
And had probably a 4-inch laceration on the top of his head like that. It looks to me like it's in the red and the dark blue area on the brain you show on the television program. And I'm wondering what that area involves. He claims that he has better eyesight since the wreck. That's one thing that's unusual. But now he's having some problems mentally remembering things, and I wondered if that would be affected from there.
Yeah, if you have a head injury, you can have increased sensory input, sometimes not so fortunate for people. But when you have a head injury, basically the head, the brain weighs about 3.5 pounds. It has a consistency of jello inside of our skulls. When you bop the top of your head, it gets all squishy and gets moved around very abruptly, and in doing so, it can increase this chemical called glutamate. Glutamate is the accelerating neurotransmitter or chemical of the brain, and increasing glutamate sometimes will cause you to have some difficulties with sensory input, and it sounds like in his case, I'd say lights were probably amplified. In other words, he probably is more sensitive to lights at this point because of that increase in glutamate. This red area of the brain here is associated with movement. The blue area behind, kind of a purple area behind it, is more associated with sensory input itself. So, number one, I'm hoping he's not having any trouble with moving his arms or legs, because that would be affecting the red area particularly. But the blue area is where you have sensory input, and you're bringing in the sensory input itself. Memory issues are not uncommonly seen with head injuries because of that surge of glutamate. You know, glutamate's a great neurotransmitter when it's used in the right quantity. It's kind of like, Oh, eyeglasses, when eyeglasses are just the right strength, they're fantastic, but too thick of eyeglasses actually worsen your vision. That's kind of how glutamate is. If too much glutamate's in the brain, you can have seizures, memory and disturbances, irritability, anger. So he probably has that surge of glutamate that was there causing some of those problems that you're describing currently. So that sometimes can go away over the course of a year or two. Sometimes we need to treat that with medications to stabilize the neurochemistry. Thanks for your call. Let's go to the next caller. Hello, Jim. Welcome to Matters of the Mind. Jim, you want to know what's the difference between Paxil and citalopram? They're both serotonin reuptake inhibitors. Paxil's a lot stronger, has more side effects, has more difficulty with withdrawal upon your stopping it, for that matter. Citalopram, it's very mild. Citalopram is pretty well tolerated. The commonality of Paxil and citalopram will be that they both will enhance serotonin transmission. About 1 out of 3 people out there do really well with serotonin antidepressants for depression, but about 2 out of 3 people don't do so well with those medications for depression. For anxiety, they can do better. Thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. I'm Psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS Fort Wayne, now available on YouTube. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
The preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.